Well, good evening, everybody. Excuse me there. This is Dr. Stephen Walker broadcasting live on Facebook, Twitter, and YouTube. Thank you for joining me tonight. This is my bi-weekly, well, not bi-weekly, but twice a week mental health live stream done live, raw. So, don't be too critical. But we're going to be talking about various mental health topics. But again, if you're joining me on YouTube, or if you're joining me on Twitter, or if you're joining me on any one of the platforms, but specifically YouTube, please subscribe and set your notifications for when I go live. Very important. Okay. Because the more people who subscribe, the higher our videos get put on search engines and search within YouTube, and the more people who will work on their mental illness and mental health. Hey, Juan, how are you? So tonight I'm going to talk about, and I want to just give everyone a heads up. I'm going to have on a certified EMDR therapist on Thursday night. Her name is Kimberly Ala-Elima. She is from Hawaii. I actually did my doctoral training on Oahu and have nothing but good things to say about Oahu. She's going to come on and talk about EMDR. She's going to talk about how EMDR can help you heal, how she uses EMDR in her therapy practice. And we're going to talk about different ways that, she uses it to help people. Please have your questions ready. That's Thursday night. Hey, Kat, how are you? Good to see you. Let us know how things are going. Hey, Penny. And please engage with her and engage with me. If you've ever thought about having therapy, if you've ever thought about doing any kind of treatment, this is a good time to talk about it, because we are two licensed mental health providers, and we're here to take everyone's question. Hey, Samantha, how are you? So tonight's topic is how to benefit from rational emotive behavior therapy. So again, please remember, these mental health live streams are for you to talk about your mental illness, your mental health. Remember, we all have a degree of mental illness. We all have a degree of mental health. It's not one or the other. Somebody sort of took exception to the fact that I was saying that we all have a degree of mental illness, assuming that I meant that's all we have. Of course, we have mental health too. We all have degrees of mental health and mental illness. The problem is people don't talk about their mental illness enough. People don't engage with themselves and what's troubling them to the point where, it just adds up after years and years and years. And the reason I'm doing this is because that's one of the problems that we have in our culture. You can see it all over the place. You can see it in polarized thinking all over our planet. You can see it in anger and violence and drug abuse. Hey, Candace, how are you? You can see it everywhere. So one of the things about these live streams is just to help people not feel so alone, not feel so like they're the only ones on the planet. And if you're on my Facebook page, please remember that I have a initiative going, a GoFundMe it's called helpahuman.org, just like it sounds, helpahuman.org. And what that is an initiative where I'm taking donations to help people who can't afford therapy so that they can get help. We're getting a few donations, but if you ever wanted a cause to donate something to, please donate that, because there are a lot of people hurting out there who don't have health insurance or can't afford their deductible or whatever. 100% of donations go towards helping people. A lot of times, as some of you know who are my patients, I will drastically reduce my rate instead of just terminating treatment in order to continue the process. So every single donation goes towards helping somebody. We had a donation the other day from somebody. Thank you very much. Immediately went to somebody who couldn't afford the treatment, and it's all a pool that people can draw from. So if you're ever looking for something to donate to, check out helpahuman.org. Just type that in. It'll take you to the GoFundMe page. Okay. Yeah, I'm going to get to that in a second, Juan. But let's talk a little bit about tonight's topic, rational emotive behavior therapy. So what I'm going to do this week and maybe into next week is I'm going to talk about different forms of therapy, because I don't think a lot of people understand that there are different ways that as licensed mental health people, we try to help people. The key is licensed, trained. A lot of people out there, mental health experts, are giving mental health advice with absolutely zero training and zero licensing. Imagine somebody giving, how I can help you. I can operate on your heart, or I can tell you how you should treat your colorectal cancer. But anyway, and they're out there. But I'm just saying that specifically with mental health, we need to have a structured form, a structured way of getting help, because you need somebody with training. And I know that sounds self-serving. Maybe it is, but I'm going to look for someone licensed if I need home repair, home improvement, and self-improvement. Should be no different. So rational emotive behavior therapy. Let's talk about that real quick, and then I'll get into some questions. Remember, please ask a question or make a comment. I'll try to get to all of them before we end the live stream. So if there's something you want to talk about, if there's something on your mind, if you need advice about a specific mental health topic, I'm not doing therapy, but I can point you in the right direction. We can talk about maybe what's going on so that you can not feel so alone. So rational emotive behavior therapy, what is that? So let's look at what it says. Rational emotive behavioral therapy. Rational emotive behavioral therapy was actually thought up, invented, however you want to put it, by a gentleman named Albert Ellis. He was a profound thinker in the field. I was lucky enough to go to some of his seminars when he was alive in New York City. Unbelievable. I actually sat across from him, and he's a crotchety old man that he would basically help people use their rational mind to work on their emotions and their behavior. So the basic ideas of rational emotive behavior therapy is you want to dispute the rationality of your dysfunctional thinking. So let's say you have a belief system that says, I can't handle going on a plane. Okay. What you're going to do is you're going to go through a series of sessions with somebody who helps you confront some of the irrational beliefs you have about flying. None of this is quick fix, people. None of this. I had quite a lively discussion with him about my belief system that you have to merge rational emotive behavior therapy with psychodynamic therapy, I'm going to do a little quick talk on that this week or next week. But psychodynamic therapy is the idea that you help people find out the roots, the whys, the why am I the way I am. He flatly, it's a waste of time. I don't know why you're even going down there. So, whatever, dude, it's your show when I was there. But I think it's very important to give people an idea of why they believe what they believe. So one of the core concepts of rational emotive behavior therapy, and you've heard me talk about it here before, is what's called the ABCs of thinking. So the ABCs of thinking is an acronym. It stands for activating event, belief, consequence. So activating event, the ABCs of thinking, look all this up online. Activating event, belief, consequence. Now, how does that work? What is an activating event? Well, an activating event, and I use this, and if any of my client patients are out there, know I've used this many times before. I start losing my hair in my early 20s, and believe it or not, because of my mixed ethnicity, I had beautiful curly, I loved my curly hair. And when it started to go, man, it started going here and then going up here and then all the way back here. And of course, back in my younger days when I was living in Washington, D.C., I had my group of guy friends, and it was just relentless teasing. They would, nickname me Stevie Hair Weavy and Chrome Dome and Chia Head and all these great things. But so that's an activating event. So I start losing my hair in my early 20s. What do I start believing about that? Remember, activating event, belief, consequence. Okay. What do I start believing about losing my hair? You can imagine, I'm heterosexual, so no woman's going to love me. I'm never going to get married. Who's going to want to be with me in my 20s? Who's going to want to be with some balding guy? Belief, belief, belief. I'm imposing beliefs upon the activating event. Remember, losing your hair, protein strands growing out of your head, that's what losing your hair is. Okay. um, uh, yeah, pictures, or it didn't happen, right, Candace? I should post them, but do I have a picture? Well, anyway, so that's the belief. I start imposing a belief upon that activating event, and those beliefs have consequences in the form of feelings. So you can imagine how I felt after a while with losing my hair. I started believing all these things. My friends jokingly are reinforcing that, through jokes and put downs and all of that. What do I start believing about myself? No one's gonna want to. I start feeling depressed. I stop going out. I stop feeling like, or even approaching women that I wanted to meet. I can even remember a period of time where I literally wouldn't go out without a hat on, because the belief system was, oh my God, if somebody sees my thinning hair, then I can't handle that. And one of the things we have to do as we get older is we have to question some of the belief system that tells us we have to feel a certain way based on what we have been, how we've been raised to believe. I have a colleague who has become quite successful because he began losing his hair, and he wrote a book, and he has a following based on losing your hair and people's inability to cope with losing their hair. And I'm not saying it's not a big deal, but a lot of it is based on how you think and feel about yourself and what meanings you ascribe to losing your hair. So rational emotive behavior therapy, a rational emotive behavior therapist will help you begin to use your rational mind to dispute the validity that you need protein strands growing out of your hair in order to feel good about yourself. Your rational mind, you use your rational thinking to dispute the belief system that says, I can't handle this. It's not fair. One of Albert Ellis's famous quotes is, where's it written that it's not fair? Where is it written that life is supposed to be fair? Now, granted, he took his belief system to a pretty extreme level, and he was very successful at it. I feel, when I'm working with a patient, you've got to emotionally connect and empathize. And that was one of his, criticisms as he got older, is as he was doing this, was people didn't feel that he cared, that he was very emotionally engaged. So, as if anybody who has gone through this work, goodness of fit, meaning how well you feel you fit with the therapist, will determine whether or not you make changes. So I think it's a combination of a lot of different things, but rational emotive behavior therapy gives you techniques to dispute your thinking in the moment. One of the things I hear over and over that people say to themselves is, I can't handle that, man. I'll tell you what, if that happens, I can't. And that's one of the instances where clinicians will use rational emotive behavior therapists to dispute the validity that they can't handle it. So Aaron Beck and Albert Ellis were kind of the founders of cognitive behavioral therapy. And if you think of cognitive behavioral therapy, think of that. My cognitions, what I think and feel, affects how I behave. And sure, the opposite of that is true. Behavioral cognitive, meaning that if I change my behavior, my cognitions, how I think, will also change. But the problem with that is, it ain't that easy to change behavior. If changing behavior was just like, I'm going to decide to stop smoking, or I'm going to decide to not kill myself, it ain't that easy. A lot of our behavior is being fed and pumped out by faulty belief systems. And so Beck had this model of depression called the Beck triad of depression. So if you think of like a circle, and you can put these in any particular way because they feed on this way and that way. But the first one is you have a negative view of yourself. Okay, that's part of the triad. The next part of the triad is a negative view of the future. The next part of the triad is a negative view of the world. So how that works is, when you have a negative view of yourself, then you're going to have a negative view of the world, and then you're going to have a negative view of the future. But if you start with a negative view of the future, it's going to feed the same way, because if I have a negative view of the future, then I'm going to have a negative view of the world, and then I'm going to have a negative view of myself, because in relation to that, I'm not going to be able to deal with anything if I have a very pessimistic view of the future. I recommend a book. I used to, well, I should. There's a book called Learned Optimism, and it's written by Martin Seligman. And, I used to be very up on recommending his book, but let's just say I invited him on the show and he was very rude, which I don't quite understand why, but maybe he was having a bad day. But I'm still going to recommend his book because maybe he was having a bad day. But it's called Learned Optimism. And learned optimism is the idea that we need to look at how we learn to be so pessimistic and how we can learn to be more optimistic. So if you look at Beck's, and you can type all this into the internet on Google and look it up, Beck's depression triad, and it'll show you that if you have a negative view of yourself, then that a lot of times is going to pump out a negative view of the future and a negative view of the world. And what a rational emotive behavior therapist will show you is that you can have techniques to dispute that. Now, remember, most of therapy, as Kim will talk about, with EMDR, a lot of these therapeutic techniques are what's known as integrative. They're eclectic. They take in various forms of therapy from multiple different forms of therapy, and they blend it. And I truly believe that that is the most effective form of doing this work, because you got to be able to have a multidisciplinary arsenal when you're helping people, because you just never know what you're going to get. You've got to be able to go between different models. And one of the things I want Kim to come on and talk about on Thursday night is EMDR, and what EMDR is about, how it can help your patients. Because if you're thinking about being a consumer of mental health services, you want to get a rough idea of what the options are out there. It's like if you were going for heart surgery or whatever, you'd like to know, well, okay, excuse me, if I don't get the actual procedure, what are my options? It's the same thing, people. Arm yourself with knowledge so that you can know what you will work best for you. Some people really like rational emotive behavior. When I was getting my, I got my undergraduate degree from Penn State in communications, and I went on and got my master's in counseling. And that's when I did the training with Albert Ellis. I went from my school in Vermont to New York to go and spend a few weeks with him and learn how to do what he did. And it was wonderful, but it wasn't the only thing. I've got a wide range. I've got multidisciplinary training in prisons, treatment facilities, private practice, schools, the whole nine yards. So and this isn't going to be an exhaustive talk, because I want to get to some questions and comments, because remember, this isn't just about me talking. This is about you engaging with what is on your mind. If you have questions, if you have anything that is affecting you, and talk about it. Great, Janie. I'm going to get to that. Thank you. So just to sum up, rational emotive behavior therapy, look it up, read some articles on it, find out whether it's something that could help you. One of the keys of success in treatment is understanding that these techniques are not, oh my God, I'm going to therapy. These are nuts and bolts techniques that you can use on a daily basis. All right. Cognitive behavioral therapy, which is what's the word I'm trying to use, is part of rational emotive behavior therapy, is the most scientifically validated form of therapy that you can find out there, meaning it's scientifically proven to work in different clinical settings, repeatable results. Look it up. The efficacy rate of psychotherapy is 70 to 80% of people who go through therapy report benefits from it. People are mad. That's what these COVID-19 drugs, that's why people are freaking out. Oh my God, such a high efficacy rate. Efficacy means just effectiveness, obviously. But imagine 70 to 80% of people who go through some sort of therapy benefit from it. But it's so stigmatized. And that's why I'm doing these live streams, so people can understand. You got to get past the fear and realize there's nothing to be afraid of, except, who was it? I think it was Teddy Roosevelt. Fear. The only thing you have to fear is yourself, fear itself. And somebody will correct me if it wasn't FDR. But that's what rational emotive behavior therapy gives you, a tool in the moment to say, well, wait a minute. I mean, so I have to hate myself because I'm losing my hair. I have to lose all self-confidence. I have to stay broken because I had some trauma in the past. I can't work through it. You use your rational mind to dispute the irrational thinking. And most of the time, irrational thinking is from trauma that we've had from our past. Okay. So let me go back and hit some questions, and I'll come back to this in a minute if anybody let's see here. Hello, hey doc. Juan is saying, I think it's tough to talk online. Some people think it should be private. Okay. Glad you clarified that you're not doing therapy. Okay. Well, when you say it's tough to talk online, Juan, you mean in this setting, like it's difficult to talk in this setting, or you mean if you're doing online therapy with somebody? And again, remember, the whole privacy thing is one of the stigmas. If there's something to be ashamed of, if I was an orthopedist, would you really be worried about privacy for me talking about how to what options are? Excuse me. What options you have for knee surgery? I get HIPAA and I get all that. We want to be private, but remember, there's nothing to be ashamed of if you're struggling with something. Okay, so Kat is saying Kat has dissociative identity disorder. She said, I've been moved to a regular room. I have surgery in the morning to repair a hernia. Oh, ouch. Okay, Kat. Well, we're all rooting for you. Glad they found it. Thank God for health coverage, because Kat and somebody else who needs it can get treatment that they need. Maybe the hernia and the pain, Kat, is causing some of the alters or some of the fragments of your personality to kind of get a little bit more stirred up. So we're glad you're getting that. Let us know how that goes. Let's see here. Picture. Oh, that's right. I said that, Candace. Candace. Good. Janie's saying, study this in my BA from psychology. Juan is saying, is that a labeled condition to have a negative view of self, world, and future? Labeled condition. It's part of depression. It's definitely part of depression. It's not necessarily something you're going to find in the DSM, the diagnostics manual of mental disorders and all that. But it is definitely part of your depression cycle, because if you have a negative view of yourself, so let's look at it. Let's look at that for a second. So if I hate myself, if I have a negative view of myself, meaning that, oh, I can't handle this, I can't deal with this, what kind of view of the world am I going to have? Am I going to have a good world? Am I going to be an optimistic view of the world? Am I going to have an optimistic view of other people? Am I going to have an optimistic view of the future? No. So yeah, absolutely. It's not a labeled condition, Juan. Great question, but it is definitely part of depression, because if you think of somebody who's depressed, that is what they're struggling with. Okay. True Story is saying, well, I just got on. How are you doing, Doc? I'm doing good. My brother or sister, I appreciate you asking. I see in the few comments that you are not doing therapy, but I do have a question. Great. Hit me. Janie's saying EMDR set me free of my rape trauma. Great, Janie. Well, Janie, maybe if you want to come on Thursday night and talk with us and with Kim, feel free to do that. We will love to hear your firsthand account of how it helped you. And if you think about some of my past guests, I'm trying to get people who are in the field, who are practicing. I'm not, I specific. So many of you may not know real quick, but there are 2 degrees when you get your doctorate in psychology. One is a PsyD, one is a PhD. So a PhD, if you remember Dr. Fortino, who came on early on, he has a PhD. So he's a teacher, he's a researcher. He has on people in the research field who, and that's great. It's complementary. we learn from each other. But I chose PsyD. Why? First off, I hate research, number one, but also because I wanted to learn how to deliver services. I love doing this work with people. So I knew early on I wanted to be taught by clinicians, and I specifically chose a school in Hawaii that was actually taught by practicing clinicians. And that's where you get where I got the hands-on approach. So everyone that I have on is going to be a practicing expert in their field, licensed to come on and talk about the gentleman we had on last week. I'm going to put up his website in a second. Dr. Steve, and he did therapy, did sessions all week, all day before his interview. That's who we are. That's why I want you guys to get exposed to us. BB is saying, hello, OMG. I just left a comment about CBT. Great. We'll put it here. Okay. BB, yes. Thank you so much for these streams. You're welcome. I'm glad you appreciate them because I love doing it. True Story saying that's him. Eisenhower. I don't really know what that means. Learning. Yeah. Argue with myself a lot. Yeah. BB. Well, what do you argue with yourself a lot about? What's going on with that, BB? Why are you now? She's saying, or he's saying, I am unafraid. Keyboard trouble, my apologies. I'm unafraid of the stigma online. Great. What up, dog? Okay, trying to learn how I can help myself and others. Well, great, BB. What I would say to you, why do you argue with yourself so much, BB? I mean, it sounds like maybe there was something in your past or some sort of trauma that caused you to be hard on yourself, caused you to treat BB in a way that he or she shouldn't be treated. You got to look at some of those roots. We got to look at, why do I relate to myself like that? Why do I treat myself the way I do? That's a very important part of the healing process, in my opinion, is helping people figure out some of the whys. I had an ongoing debate with a behaviorist colleague of mine when I was living in Oregon, and she was the idea, why do you have to tell people why? And I don't know, man. Why do people try to figure out why cancer is cancer? Because, you want to find out the whys to treat some of the root causes. Okay. Also, BB saying I was diagnosed with bipolar. Okay, BB, I hope you're working on that and you're getting some medication for that. Bipolar 2, so that's probably the depression one. Bipolar 1 is more the mania. PTSD with moderate intermittent explosive disorder and therapy is what helped me. Great, BB. Well, I don't know how much you want to get into tonight, but what was some of the trauma? What was some of the great? A psychologist who has experiences help you. Beautiful. Juan is saying I was asking that label question for my bro who has a negative view of people and places so much that he just isolated himself when before he enjoyed it. Sounds like depression, or maybe he's okay with it. Yeah, Juan, it does. Definitely sounds like something's going on with your bro, because if he's isolating and he used to be more social, or he used to be more outgoing and more, kind of, that kind of boy kind of friend of yours or brother, then yeah, maybe he had some trauma. Can you think of anything that may have exposed him to some trauma, or maybe you guys had something from the past that needed to that still hasn't been worked on? But again, the fact that people are engaging with me live is why I'm doing these streams, because there's so many talking heads out there, and there's so many people who just post videos to get likes and all of that. And that's all fine and good, but I like this engagement, because what it does is it gets people to start thinking like, hey, really, there's nothing wrong with talking about this. It's not even that hard. And once you cross over that fear, you really begin realizing that a lot of this work, depending on your level of trauma, as some viewers know, depending on what level of trauma you have, okay, baby, thanks. He just takes his socks off in the middle of my live stream, but what can you do? Anyway, but depending on your level of trauma, a lot of this isn't as difficult as people think it is. It's not, because the fear that keeps people from working on it is part of what Rational Emotive Behavioral Therapy will help you realize, because listen to the irrational thinking. I can't deal with that. Oh man, if I face those demons, they're going to overwhelm me. I can't handle that. And that is a belief system that you need to stop in the moment and go, wait a minute. What? Where did I learn that I'm going to be overwhelmed by this? I use racism as a perfect example of that. my 5-year-old kid right here, he's not racist. There isn't a racist bone in his body. Now, if I teach him to hate all black people, all white people, all Spanish people, all Jews, all whatever learned hate we have, he's going to identify with that as who he is as he grows up. And that's an irrational, a dysfunctional, conditioned, irrational belief system that hopefully anybody who's a racist out there who believes that I'm a racist and there's nothing you can say, my brother or sister, you were not born a racist. And you know what else we weren't born, people? Self-haters, self-doubters, people who are crippled by fear. It's not how we were born. Okay, you may think it's how you were born because of your early childhood conditioning, but it's not who we are. And rational emotive behavior therapy can help you begin disputing some of that. Get to a few more questions here. Melissa's saying, hey, Melissa, I needed the why. Absolutely. Without the why, I couldn't control my emotional reactions to everyday things. We'll talk about that, Melissa. How did getting the why help you? How did the why help you control your emotional reactions to everyday things? And thanks for your note, by the way, Melissa. The book will be out soon or something, the app or something, but I'm finishing some research on that. Let us know, Melissa, how did the whys help you? True Story from YouTube is saying, my question is, how can I help myself with caring so much of what other people think? I've actually been doing drugs lately, and that's not me. It's easy for other people, but not for me. Part one of the question. Well, True Story, my brother or sister, you got to start facing the reality that somewhere along the way, you learned that other people's opinions can damage you, can hurt you. So I would guess that there's some kind of trauma from your past. You're either bullying, or maybe you had an overbearing parent, or maybe you have, I don't know, maybe you have a physical deformity or something that caused you to care too much about what people think. And I am not advocating the I don't give an F way of looking at things. Not giving a F, you know what F stands for. That is associated with so many mental illnesses, people who don't care how they affect people who don't care what other people think. It's all over social media. I don't care what anybody thinks and all that. Like, that's healthy. Not caring is not healthy, people. Now, you can care too much, but don't make your goal not to give an F. I know there are books out there written by non-psychologically trained individuals making millions, but it's bullshit. Excuse my language. It's complete nonsense. Oh, sorry about that. Don't use that word. What? That word I just used. Don't use that word. Whoops. But it's BS, because what you're training people is the idea that not caring is the way to go. And that's not the way to go. We need to learn how to manage how we care. So, True Story, I'll look for your follow-up, but I'm guessing there's something going on in your past that causes you to care a lot more, like giving too much credence to what people think. Juan says he sees himself suffering as a Republican American in these times. Crazy how we demonize each party and what it does. Absolutely. Brother, there is so much polarization. I'm a Demopublican. You ever want to check out one of my little side websites? Type in Demopublicans, like Democrat publicans, like Republicans, demopublicans.org, because that's how I believe. I have beliefs from both sides of the political spectrum, and I lean more liberal, sure, because I believe we need to be helping people. I believe we need a government that can help people who can't help themselves, not create dependency. Get in all that another time. But yeah, a Republican, a diehard Republican or Trump supporter must believe that the country's ending right now. And it's not. They believe that when Obama, they believe that when Clinton, they believe that. Same thing with Democrats. They believe when Trump can't, well, you know, insurrection aside, you know, a lot of my hard left-leaning friends thought it was the end of the world when Trump was elected. We need to find some balance. Okay. So yeah, I would imagine a Republican nowadays is, must feel that. So BB's saying it was trauma. Yeah. Okay. I'm not trying to be Mr. Know-it-all, but it sounded from what you were saying, BB. I'm a woman and my real name. Hey, Tara, how are you? Well, thank you for logging on. Please share this. Okay. Nothing to be ashamed of that you were traumatized. I don't know how much work you've done on it. Oh, you said you have a psychologist. That's right. I argue with myself because I'm conflicted with that fear issue. Sure. And I'm sure if you've been, depending on your degree of trauma, I don't know what you're talking about with trauma. I don't know if we're talking about, early childhood trauma. I don't know if something happened to you as an adult, but, remember, PTSD is one side of the spectrum, people. There's post-traumatic stress disorder on one side of the spectrum, and on the other side of the spectrum is post-traumatic growth. PTG doesn't get a lot of press, okay, but PTG is where you can get to once you work through some of the trauma. So Tara, what I would recommend to you is deal with that fear. Remember, somebody came up with the acronym for fear. It wasn't me, but I use it a lot. False evidence appearing real. What is the false evidence that appears real? Yeah, you're right. We don't eat too much cake and sugar, Bubba. You're right. What is the false evidence that appears real? Well, the false evidence that appears real is that I can't handle that. I can't deal with the trauma. I can't handle what is going on. That's the false evidence that appears real. Okay, Tara. And so you have to work on that. Somehow I feel that the feed just got interrupted, but we'll just keep going because this is live. So we need to keep working on that fear, that ability to believe that I cannot heal. Tara, you can heal from this, okay? You can heal from this. You've got to keep believing that and working on it, okay? Let's see. BB, I agree with him. He is perfect. I don't know who he is perfect. True Story is saying part 2, I'm a stand-up guy, speak my mind, but I know I shouldn't. So I end up getting mad and want to fight them for them judging me if I'm something I'm not. Well, what I would recommend is that you got to look at how you're judging yourself, brother, because it sounds like you're projecting a lot of your belief systems on other people. You have to you have to look at what is going on with your relationship with you and how that's affecting you. Okay. You've got to work on that because a lot of times we're projecting outwardly how we feel about ourselves. And so what I would recommend for you is you got to work on, I end up getting mad and want to fight them for them judging me as if I'm something I'm not. Well, you got to accept you can't control what they think about you. People can barely control what they think of themselves. You got to work on what you think of you and how you feel about you and why why them thinking negatively about you has to bother you so much. Okay, you've got to get into the belief system that tells you that. Okay, right. His socks can be bothersome. He's a great kid, though. My sister isolates like your brother, Juan. Also, she suffers from mental health issues, but she has an aversion to people. Okay, well, that's something that needs to be worked on. Hey, Severina, how are you? Good to see you back. Yes, people are taught to hate. True story. Absolutely. Janie's saying, for one that has studied psychology, why am I so depressed, but have no problem giving hope to others? I feel so alone and trapped. I'm spent, but seek some hope. Well, Janie, you've talked about some of the stuff from your past with your dad and some of those unhealed wounds and how Janie has a tendency to focus negatively on what Janie is or isn't doing, what she should have done or shouldn't have done. And Janie, it's great to hear you say that the EMDR helped you with the rape trauma, but that's just the beginning of some of the work. Maybe you can't, you have no trouble giving hope, but you feel so alone and trapped is because there's some other layer in you that is preventing you from giving that advice to yourself, that ability for you to self-soothe. We've talked about Janie can be her own worst enemy a lot of times and how that affects you. So we've got to look into, okay, maybe I need to re-engage with somebody and do some more of the work. Janie, remember, Jane, those of you who don't know that Janie's on the frontline healthcare provider working with COVID and working with the pandemic. So she's, Janie, you could have that vicarious traumatization too, where you just feel so spent seeing death and hopelessness a lot that it's difficult for you to give that to yourself. Janie, you got to re-engage and actively start working and go into somebody's office or hire somebody and ask them, I have no problem giving hope to other people, but I feel so alone and trapped. Why do I feel so alone and trapped? And there's some reasons in there. Maybe that's what little Janie felt growing up that she hasn't gotten to and healed. Okay, BB's saying it does not matter what anyone online or even in front of us thinks or says about my mental health or not. Okay, well, that's good. We don't want to take that too far because remember, my thought on that is not caring is not healthy. So we want to find a balance between internal locus of control. I'm going to talk about this another show, but internal locus of control and external. Internal is you're more primarily driven from within. External is you need external validation. So yes, when it comes to mental health and people being judged for mental illness, absolutely. That would be one of those things where I would say, okay, well, gee, what's going on within you? Why are you so averse to mental health that you have to pick on somebody else? Okay. Hey, Josie, how are you? Good evening. Melissa saying my anxiety presented itself as aggression. Once I discovered I wasn't actually angry, but full of fear, I could focus more on what was creating the fear. Beautiful. Beautiful, Melissa. Let's read that again. My anxiety presented itself as aggression. Once I discovered I wasn't actually angry, but full of fear, I could focus more on what was creating the fear. Great. Beautiful. Look for that false evidence that appears real to you, people. Dispute the validity that you cannot handle fear, that you're not supposed to be afraid. It's okay to be afraid, okay? Mindfulness techniques help. Absolutely, BB. True story saying, well, I do care because I treat other people how they want to be treated, but sometimes it grinds my gears. Well, if you're not getting that back, then it's going to. But remember, just because you're not getting it back doesn't mean you're on the wrong road, okay? Treating people the way you want to be treated leaves you in a place where you feel good about yourself, okay? Sorry, my nurse came in. Hey, Kat. LOL busted. True story, same hate. Here I don't care anymore. Replying to Samantha. That is why I have PTSD. Beautiful. Peggy is saying, you lost me when you spoke out the insurrection word. Why do we just have to interject these little digs? It's not a little dig, Peggy. Juan made a comment about his brother being a Republican and what he's going through, and it's not a dig. Okay, if you took it as a dig, I apologize, but I don't understand why what happened on the Capitol, everyone isn't looking at as the worst dig that has ever happened. Okay, Juan made a comment about his brother being a Republican. I was taking an example. Did you feel that the dig I did on the left was a dig, or is this a dig on the right? So Peggy, please chime in. Let me know why you took that as a dig. It's not a dig. Personally, what happened on the Capitol was deplorable, was disgraceful. So a lot of people are very worked up by that. So if you took it as a dig, that's not the way it was meant. But it was an insurrection. It was people invading the Capitol. I mean, anyway, so no dig intended, just an example of extremes on the left and the right. Samantha saying, I am R and my world is not crushed. The pendulum swings. Beautiful, beautiful. True stories is I'm 6'4", I've been to prison, big guy, I have no problem FNing someone up, but it's that I'm in my mid-30s and I'm trying to get my life right. Beautiful, man, beautiful. I've lost family and friends because of what they believe. Okay, well, it sounds like you're in your 30s, my brother, and I would recommend hiring a mental health person, licensed mental health person, to work on what is going on within you, to work on some of the anger, to work on whatever. I've worked in prisons, man. I've worked in I work with mass murderers, literally mass murderers. I've worked with pedophiles, rapists. I mean, the worst of the worst. A lot of the people who have been to prison have had trauma in their lives, have had incredible amounts of violence put upon them as children or have witnessed violence. So maybe it's time for you to work on some of that, okay? I don't know what that means. I'm bouncing around here, so maybe you can fill me in on that. People say I'm intimidating looking in person. Well, maybe you should keep that in mind. That's called stimulus value. Stimulus value is, what do I stimulate in other people? Maybe you should be more aware of that. Maybe if you should call that out. Look, I know I can be a little intimidating looking. I know when I work with kids, man, I'm 6'3", So, when I ever work with kids, I immediately get down to eye level so that they don't feel like I'm hovering over them, but call it out. If you ever work talking to somebody, call out the elephant in the room. Not trying to be intimidating. I'm just a big guy. Candace is saying PTSD can be dealt with and managed. I am on the good side of my story right now. Beautiful. And Candace, we interviewed Candace on here a couple months ago, and she's done a lot of work on that. And she will be the first to tell you, it's a work in progress. It's a healing process. There's no healed, it's healing. It's a constant state of healing. And yeah, Candace is right, but you got to do the work. And Candace, she has accepted and integrated into her, is on the extreme side of trauma. Candace is not everyone has the level of trauma that Candace has, but she's talking to people from that extreme place saying, look, you can work on this. These things can be worked on. And that's one of the main reasons I'm doing these live streams, people. Do not suffer in silence. Do not buy into this idea that you're broken for life. Do not buy into this idea that people never change and you can't teach an old dog new tricks and all this crap that people say who don't want to work on their issues. It's funny how the people who say people don't change are the people who don't work on themselves and never change. So thank you, Candace. Absolutely. Everyone can get a degree of healing. Now, does that mean you're going to be healed from it and never think about it and never have it affect you? Perhaps, but that's way down the road of the work, okay? So let's say BB saying people are intimidated by my intensity and I get asked if I'm angry constantly when I'm just chilling. Well, bro, that's some feedback you need to look at, my brother. If people are sensing that anger, then it could be that there's some anger inside of you that needs to be dealt with. Maybe you got abused as a child. Maybe there's some things you have a right to be angry about. I don't know. But if you're getting a lot of that feedback from people, then maybe you should stop and think about, well, what am I so? Maybe I am too angry. And you got to accept it and start working on it. Okay. Let's see here. Let's see. Just want to see if the person who took offense to my comment about, and let me just clarify something, people. Okay. I'm not an extremist. Okay. Do I have some extremist views? Sure. I believe, we shouldn't be killing each other. We shouldn't be doing the kinds of disastrous things we do on a daily basis. But most of my belief systems are yin yang. I'm not a polarized person. Okay. So if you're going to come at me with a polarized view and impose that upon me, it's not going to work because that's not where I'm coming from. I allow multiple things to coexist in my mind, and I look at them from a perspective different than I have to be this or that. Do I have some core beliefs that I believe in? Absolutely. So whatever my insurrection comment that ruffled the person's feathers, that wasn't my intent, but I was trying to give an example of extreme thinking on both the left and the right. And if you don't think, whoever took exception to my insurrection comment, if you don't think that people on the right have gone off the deep end when it comes to their belief system, when it comes to QAnon and all these other things, then you need to maybe explore your belief system. And the same thing on the left. Defund the police? Give me a break. Defund the police? You know how many free sessions I've given out to police officers and military people? Absolutely not. I want to defund the police or get rid of the military. So anyway, that's where I'm coming from when you hear me said about the comment about the insurrection. And if you don't think it was an insurrection, I don't know what you consider an insurrection. But all right, well, let me see here. We're gonna wrap up here. Let's see. Let's see. Even if you're diagnosed, there's still nothing wrong with you. Absolutely. People look down on people with disabilities, people that are different. That's a fact. That doesn't mean you got to look down on yourself. Absolutely. Thank you, Doc. And a finish. Okay, Janie. Thanks for logging on. Janie, check us out. Check it out Thursday night. Okay, we got that EMDR. Kim Ala Elima is coming on. You can look her up. Night Dog, be well. You too, Juan. Kat is saying I was moved out of psych this afternoon to a regular room to prepare for surgery tomorrow morning. I'm getting it done while admitted to lessen my exposure to infection. All right, Kat. Well, good luck to you. Remember, that's going to help you heal. That's going to take away some of that physical pain, which then could take away some of the psychological and emotional pain. Okay, good job. Let us know how it goes. I do call it out when need to be, but then I became right with God. Beautiful. And Doc, look up what your name means. I bet it fits you perfectly. Okay, great. It's funny you say that, man, because when I was going through my doctoral program, I did that, and the life purpose came up as doing what I was already doing. So I feel you on that. The person who may have taken my comment the wrong way, my bro is very open about his Republican views and feelings about the government. Great. I hope, bro, all I would encourage you to ask him to do is try to find some balance. I always ask people on the right, you don't have any liberal views? You don't have any? You're just polarized? And people hardcore and left, you don't have any conservative views? You don't have any? And that's where we get unbalanced, people, is when we need to be this or that. And that is what one of the main problems in our society is, people needing to be all or nothing. And that then they spend their life, no. And then they're just so polarized. And we need to do something, because all this hate, left hating right, right hating left, I'm worried. I'm really worried. The belief in extremes is what saddens him. I understand his sadness. Great. Well, Juan, it sounds like you're a good brother, man. What I primarily hate is that this is a true story, that people smile in your face and stab you and talk trash behind your back, and then you hear about it. I do cut them off, but yeah, angry. Yeah, I feel you, man. I feel you. When you feel you know somebody and then they stab you in the back, that's painful. But again, remember, you don't have to own what they're saying. And it doesn't mean that the person who's stabbing you in the back is any more real than the person who's being the people. We're all guilty of stabbing people in the back and acting like we're not. So Candace is saying, no, I have accepted. It's part of me, meaning her PTSD. I was angry at myself for years, but that it would always be there. But once I accepted it was there, the healing became easier for me. Absolutely. And that's what it's about. And as Candace is to be the first one to tell you, she's working on it. She's working it because her degree of trauma, oh boy, I tell you, Candace did her decision to get treatment on that. I wasn't her only provider. She had providers before, but everything she did along the way, boy, she hadn't done that. You know, Candace, why don't you tell us where you think where you'd be if you didn't have any treatment? Not killing each other is not an extremist view, Doc. Not killing each other. No, I didn't say that that's an extremist view. We shouldn't be killing each other. I'm saying that I believe that's an extreme. Oh, I see what you're saying. I'm saying that my extreme, I have an all or nothing. I should say I have an all or nothing view that we shouldn't be killing each other. I don't believe that killing each other. Now, if somebody breaks into my house tonight, or does something to my son or wife, or comes at me on the street and I can't talk myself out of it, it ain't gonna be Dr. Steve. What's in it is saying from YouTube, when I get angry, I always have a temptation to masturbate. Is that an issue? Don't know if you're being serious, but if you are being serious, I'll take it as being serious. If you're not being serious, then pick another live stream to troll. But I would say if you're masturbating as a way to deal with anger, then there's something going on there. I don't know if you've had some sexual trauma. I don't know if you use masturbation as a way to calm yourself down, but there's something that needs to be worked on there. Absolutely. You are being serious. Okay. Well, then I would ask you, do you have any sexual trauma from your past? Were you sexually violated? Did you get used to chronic masturbation as a way to deal with emotion? True story. Thank God. Yeah. God bless you too, brother. And keep logging on. True story. Keep working on this. It's okay that you have these issues, man. You got to work on them. I've worked with people from prisons, and I've done violent offender groups. I've done all kinds of things, bro. There's some trauma in you that hasn't been healed, my brother. Okay. So he's saying no. Well, if I was working with you, I would try to look at what is making you so angry. Like, why do you need masturbation to deal with the anger? It's not going to be solved tonight, but it's something that I would look at a little bit further. Yeah. So let's see. Janie's saying, I have been a victim of childhood incestuous for 5 years, relationships in my 20s, raped 3 times in marriage to a monster, then remarried an unfaithful prick. Insurrection is the truth of this Trump BS. I hear you. Can we do online therapy? I don't know who's we. Do you mean like you, if you want to do some private sessions with me? Yeah, we can talk about that. You know, I have to check out my schedule, but yeah, shoot me a private message and we can talk about doing some of that. Janie, absolutely. Candace is saying I wouldn't be here more than likely, exactly, if she hadn't worked on it. So excellent. Melissa's saying I still feel without the 9 years of therapy I've had that I would be dead in a ditch. My self-sabotage was horrible. Exactly. And that's exactly why I'm doing this, people, so that you guys can hear from people who have gone through the process what healing feels like. And if you're out there watching this and you're feeling, if you're feeling that it's hopeless and you're never going to heal, that belief system, remember, ABCs of thinking, activating event. I have trauma, the belief I'm never going to heal. I'm never going to get better. What's the consequence of believing that? You got to get into that belief system. Okay. You got to, because you can absolutely heal. Hankus from YouTube is saying, love you, man. Keep up the good work. Nothing but respect in times like these where everyone is struggling. Thank you, my brother or sister. I think you're a brother. But I appreciate that. That's why I'm doing it. That's why I don't charge you for it, because I want people to understand that there is hope. Hope, I don't mean, oh, everything's going to be great and oh, life's wonderful and there's no negativity and oh, just focus on the positive and just eliminate all the negativity. That's bull crap. Excuse my French, okay? Don't say that word, okay? Crap, that's not a good word. But you can absolutely heal. You can absolutely work on what is causing you emotional and psychological pain. Those emotional wounds can heal, but you gotta work on them. Okay, and one of the things people do with their emotional and psychological pain is that they hate how they feel, and that just infects it more and more. Not saying they love it, but there are ways you can learn to integrate it and accept it into you. Okay, yeah, exactly. It's going to be Walker, Texas Ranger. Exactly. Man, I wish I had his skills. But all right, people. Well, thank you for logging on. Remember, tomorrow, Thursday night, Kim Allah Alima, certified EMDR therapist from Hawaii, is going to be joining us. Tune in, ask questions about EMDR if you've ever thought about doing it. If you've had EMDR, please share this so you can realize that these psychological and emotional interventions are, take care, true story. Thanks for logging on. Are accessible and dealable and workable. Okay. Please do not give up on believing that you can heal. All right. If you're catching this on YouTube, please subscribe. Check out some of my other videos. I got a lot of content on there. Please subscribe and set your notifications for when I go live. Please like my Facebook page and YouTube. Why? Because it helps get our videos up higher. All right. All right. Well, I'll see you guys Thursday night, 9 p.m. You can know all those from 9 p.m. Eastern on down. And we'll see how things go with Kim. And we will talk more about it. Do you want to say goodnight to everybody? Okay, come real quick. And we'll say, we'll see how things go. Please have your questions about EMDR. And we will talk more about it. Say goodnight, everybody.
Good night, everybody.
Okay, everybody. Thanks for logging on. Take care, everybody. Love you.